question. So Dr. Adnam is there with us, I think.
Yes, hello everyone. So how do you do this? Do you want me to explain the question or what?
No, you can.
Dr. Janti will get somebody to talk about the question.
Mm-hmm.
Dr. Janti, please. I will read quickly. A 32-year-old man is brought to the hospital with complaints of rapidly ascending weakness in his distal extremities. On physical examination, there is an absence of deep tendon reflexes, and CSF analysis revealed normal cell count and elevated proteins. He completely recovers within the next 6 weeks. What kind of neuropathy is he suffering from? Dr. Janti?
All right, I would like to ask for a volunteer. Please raise your hand to be selected for this question. All right, anyone?
Anyone from the class, please.
Okay, so we have Ariz.
Yes, Assalamu alaikum.
Wa alaikum salam. Go ahead, Ariz.
Okay, so this guy has rapidly ascending weakness in his distal extremities, and he has elevated protein and normal cell count. So this guy has GBS. GBS is a form of demyelinating disease, of acute demyelinating disease, and causes rapid ascending weakness. So the answer is A.
That's correct, yeah.
Okay.
So this test, the concept of neuropathy, the basic concept of neuropathy, and you're giving very few clues. You don't know anything about the patient except the age, which is young. And then the CSF has no cell count, so not a lot of inflammatory cells. And then the elevated protein, you might be thinking of immunoglobulins. So that's the correct answer.
Can we move to the next question, please?
Can we ask the question?
Yes, please go ahead.
For the previous question, there is a new disease that I don't know. How can I know it's acute demyelinating?
Yeah, so Dr. Adnam, are you going to respond to this question?
Correct, yeah. So the question is, why is it demyelinating? This patient is it axonal or demyelinating neuropathy? Usually, if you know if you've covered the lecture of neuropathy, the pathological causes of damage to the nerves are either demyelination, which affects the conduction velocity, the speed of signal transmission, or loss of the axons, which is mainly usually due to trauma or diabetes or other systemic diseases. So from the scenario you have here, it's an acute illness with weakness and then spontaneous recovery. So most likely it's not a damage to the axons. So you're most likely dealing with a conduction, a disease that affects the Schwann cells or the myelin sheaths that affect the conduction of signal transmission.
Thank you, Dr. Smith.
You're welcome.
We can move to the next.
Dr. Janti, if we can get somebody while I'm reading, please. A 3-year-old girl is brought to the physician by her parents who complain that their daughter continually loses her balance and has slurred speech. Physical examination confirms the truncal ataxia and wide-based gait. CT scan of brain shows presence of a midline tumor. Which of the following tumors is she most likely to have?
All right, Hamza, I have enabled the ability for you to unmute yourself. So please take turns.
Yes.
Hamza, can you please unmute and answer the question?
Assalamu alaikum.
Walaikum
Yes, so this girl has a midline tumor. It causes truncal ataxia and wide base gait. So this means that it's most probably in the cerebellum. And the tumor that affects the cerebellum is medulloblastoma. It affects the granule cells of the cerebellum. And because of the mass effect of this tumor, the truncal ataxia and wide-based gait will happen because of the compression of the cerebellum itself. So, yeah, so it's B.
Dr. Ahlam?
Very good. Actually, you're spot on. You have a lot of clues in these questions. You have the age of the patient. We know these medulloblastoma are tumors of children. And you have tumor and the